Coming in Facebook, coming in YouTube. We're getting ready to start my show called Jimmy Rants. Johanna, I want to know what kind of magic you do when I go live. As soon as I go live, I get a hello from you. Like literally, it comes on and you're right there. It's almost like you have that preset for me to say hello. Where's Waldo? I mean, Jimmy, I'm right here, right here. Thank you for being here today. Come on in, Tracy. Hello, Norma. Thank you guys for being here today. Getting ready to start Jimmy Rants pretty darn soon over on Instagram. Looks like T-minus less than 2 minutes left. And a really good one for you guys here today. I try to kind of mix up the topics so it's not always the same kind of topics. That way it's truly a variety show, Jimmy Rants is, and you never know what you're going to get. I have been obviously a lot on the COVID stuff lately, just there's so much to talk about with that. But today, it's still about COVID, but it's indirect with COVID and some of the health consequences that are coming from an action that is happening because of COVID. Well, hello there, PJB. Thanks for being here from Houston, Texas over on YouTube. Thank you for being here. So we're going to get started with my show, Jimmy Rants. Those of you that are new to the show, this is a show that I host. My name's Jimmy Moore, and I like to talk about all kinds of things. And so this Jimmy Rants show is my outlet for sharing about pretty much whatever's on my mind. A lot of times it's news of the day. I am in the nutritional health space, so I talk a lot about diet and health, but pretty much anything. Hello, Darlene from El Paso. My Texas contingent over on YouTube has shown up today. So thank you guys, yeehaw, for showing up here on Jimmy Rants today over on YouTube. Did I do that okay? See, I'm from South Carolina. We don't say yeehaw here in this part of the South. Hello, Shirley. Thank you for being here today. I've noticed something very odd over here on Facebook the last couple of days. I see a few people come on and then it goes just silent. So I don't know if that means not many people are on or if it's just different. Linda from Chattanooga, Bill from Dallas. Yeah, lots of people. Hey guys. Linda says, hey y'all. Yeah, we do say y'all in South Carolina, but we don't do the whole yeehaw. I guess that's totally a Texas thing. So, all right, let's get this show on the road. And here we go. Mike from Oregon. Wow, what time is it in Oregon? 8 a.m. in Oregon. Good job, Micah. Sorry, I said Mike. That far away, I couldn't tell it had an A on the end. All right, here we go. What will be the ramifications of people avoiding the hospital during COVID-19? Find out here today on Jimmy Rants. Click on that little box down there in the corner. It'll take you straight to IGTV for today's episode. JimmyRants.com is the website, and as always, you can engage live in the content. Please go follow me right here on Instagram. I am at Livin' Low Carb Man, LIVINLOWCARBMAN. Once you're there, engage live. We are here Monday through Friday, 11 a.m. Eastern Time. And yeah, we're right on time at 11 a.m. every single weekday. So thank you guys for being here today. We also simulcast over here on my Facebook page. So thank you guys. I see Don just popped into the room. Thank you guys for being here today. And then finally over on my YouTube channel, lots of people over there, a bunch of Texas people today. So thank you guys for all watching here today on Jimmy Rants. If you missed the live here on Instagram, you can watch it on replay right here on Instagram right after it's over. It's on IGTV, so you can watch the replay there. You can also watch the replay over on YouTube. Just type in a keyword Jimmy Rants, you will find the show. And then finally, we do have an official website for this show. It is JimmyRants.com. So once you're over there, you can enjoy all the past episodes that we do here on the show. And while you're there, it's your way of being able to support me with the Patreon link. So click on the Patreon link, and a donation of any amount would be greatly appreciated. And for those of you who are supporters of my Patreon, we just put up next week's episodes of my podcast up there early. So that's one of the perks you get for being a Patreon supporter. You get early access to the interviews before they come out on my podcast. So they're there right now if you are a Patreon supporter. We are working on, and it's a secret project, shh, don't tell anybody, but we are working on having a live stream capability at jimmyrants.com. We're a little bit frustrated with some of the challenges and the censorship that's going on traditional social media. So we're creating that kind of atmosphere at jimmyrants.com right now. It's not live yet, and we're going to test market it soon. So if you're a Patreon, you'll be the one that we test market it with, and we would love to have you join. My goal is to do some exclusive Jimmy Rants episodes just for my Patreon. So go support me at the Patreon link at jimmyrants.com. Okay, you guys, today I want to talk about something that I really haven't heard anybody talk about as it relates to COVID-19. Because we have a great deal of people who are highly fearful right now of this virus. Now, whatever you believe about the virus, if it's a scam in your mind or if it's extremely real, I think we all have to deal with the ramifications of what all the hype about it has done. And what the hype has done is it's put it on the radar screen of people that they need to be cognizant about it. And so that fear that has been put out there, and some people say it's justified fear because this is serious. Others say it's overblown fear. Regardless of where you stand on that, the fear is real. And so people have been fearful of going to the doctor because of fears of getting COVID-19. And I want to read from a news story here in just a minute about how, I was seeing where it was from. Health Leaders Media is where it's from. But about what the unintended consequences are of people not going to the hospital because they have various health symptoms that show they need medical care, but they don't want to go to the hospital because they think they'll get COVID-19 if they go. What's that going to look like? Before I get into that story, though, I want to read a CNN story. COVID-19 will end up as a top 10 leading cause of death in 2020, according to a statistician from the CDC. Well, I read the headline and go, okay, you've made people think like everybody is dying from COVID-19. So I would not just believe it to be in the top 10 of causes of death in 2020. I would call it number one based on the hype. Would you guys agree that the way they've kind of hyped this up to us, you probably think everybody's going to end up dying of COVID-19? That's the way they want us to believe. And the other thing that kind of keeps popping in my head is, okay, what are the actual top 10 signs of death, or causes of death, excuse me, in America? You want to hear what they are? Number one is heart disease. 655,000 people die of heart disease. Number two is cancer, 599,000. Number three is an accident and unintentional injury, 167,000. Number four is chronic lower respiratory disease, 159,000 people. Stroke is 147,000. Alzheimer's disease, 122,000. Diabetes, 84,000. Flu and pneumonia, 59,000. Nephritis, 51,000. And suicide, 48,000. So we've had, roughly 160,000 people now die of COVID-19. So if you plug that number into this list, obviously we still have some more of the year left, but if you plug it in, it would currently be the number 4 cause of disease in America, cause of death in America, in the top 10. The problem people are having is, what's happening with all these other categories? So they're labeling things COVID-19 deaths, and they have these comorbidities about them. So someone that has a heart condition that might have had some kind of a cardiovascular event due to heart disease, they die of COVID-19 and they're listed as a COVID death, but they also had heart disease. So are we going to see a commensurate drop in heart disease? A commensurate drop in cancer, and all these other things. Now we know statistically suicide is going to be up. Suicide will be much higher than 10. How much more we don't know, because suicides are still happening in the midst of the stress of all this. But that's what's been lingering in my head. Okay, we're going to have all these COVID deaths. What about the rates of all these others? I just read you off the statistics of what they have been. Will we see heart disease not be 655,000 people? Watch it be like 400,000? I don't know, 550,000? That would be a significant drop. We don't know. We won't know until you look back at it in retrospect at the end of the year. So if you're just joining us, we're looking at the lasting health consequences from avoiding hospital care. And I just read off a list of the top 10 leading causes of death in America. They're predicting that COVID-19 will be in that top 10 in the year 2020. But the top 10: heart disease, cancer, accidents, chronic lower respiratory disease, stroke, Alzheimer's, diabetes, flu and pneumonia, nephritis, and suicide. Those are the top 10 leading causes of death. And so I'm positing a theory: when COVID-19 ends up in the top 10, what's going to happen to all these other rates? Because these rates pretty much stay relatively static. Heart disease has been the biggest killer. Cancer's right behind it. And it has been for many years. Will we see a dramatic drop? And I mean, dramatic would be like a 20% drop. Can you imagine if we drop 20% in heart disease and cancer? But then we have all these new COVID deaths. This is what concerns a lot of people. And it's not going to go away, that concern. Because if those statistics do come out, people are going to have their nose kind of crinkled again and go, well, no wonder that's where all the COVID deaths came from. It was actually people that were going to die of other causes. Now, medical people will say, well, COVID sped it up, so therefore we have to call it a COVID death. But if you have a broken arm and you go to the hospital and you test positive for COVID, and then that broken arm gets infected and you die from the infection, is it a COVID death? I don't know. I guess it depends on the doctor. And then all the hospitals getting incentivized to have COVID patients. This is what people are reading, and it's one of the things that's keeping them out of the hospital. So I want to get to the main article I want to read here today. Avoiding care during the pandemic could mean life or death. The coronavirus has so diminished trust in the U.S. medical system, and that is so sad. Are you hearing that? This coronavirus, we're all so fearful that if you go to the hospital, you're going to get diagnosed with COVID-19, and they're going to put you on a respirator and you're going to die. That's the image they're trying to put in our heads. And so people aren't going for the routine care that they need to go for. When they have signs of things going on, they're just not going. Even people with serious illnesses are staying out of the emergency room with potentially mortal consequences. This is the thing too. People are not going to the hospital when they have angina, for example, to get heart pain, chest pain, and they need to go seek medical attention to see what's going on, and they're not going. And if you don't go at the first sign of chest pain, you may have a massive heart attack and die. You could. So a CDC study found that emergency room visits nationwide fell by 42% in the month of April, from a mean of 2.1 million a week down to 1.2 million a week, compared with the same time period in 2019. A Harris poll found that roughly 1 in 4 adults experiencing a heart attack or a stroke, listen to this, 1 in 4 would rather stay at home than to have the risk of getting infected with the coronavirus at the hospital. 1 in 4 that need medical care, that have a heart attack or a stroke, they'd rather just deal with it at home. To me, guys, that is sad. That is an indictment on how this public health crisis has been handled, because we don't need to make people so fearful of a virus with a death rate of under 1%. When if you don't get medical care and you have a heart attack or stroke, you could die, 100% chance you could die. And that's what's been sad about this. The unintended consequence, the lasting health consequences of avoiding hospital care, we're going to see it in the statistics in the coming years. 2020, 2021, 2022, you watch what happens to deaths by heart disease, deaths by all kind of like chronic diseases, that because people didn't get the care they needed. And I think about cancer patients right now. I have heard a lot of cancer patients had to miss chemotherapy treatments because they were fearful in their immunocompromised state. They were fearful of getting COVID-19 if they went in for the treatment. And so this is real. This is something I'm not really hearing a lot of people talk about. Perhaps even more worrisome is the drastic fall off of all the routine screenings, especially in regions that are hit hardest by the virus. Well, that's the thing too. Everything that was kind of an elective surgery or an elective screening, they delayed it. Well, there's a reason why. Yes, it's elective, but there's a reason why you do the screening. You do the screening so that you can catch something soon enough before it becomes something really bad. Well, a lot of people have missed those screenings and they still haven't scheduled those screenings. So what's going to happen to those people and their health? At this point, it's an unknown. At this point, we know that no care can be potentially risky for those patients. These days, Los Angeles acting teacher Darren Warren balances her pain with her fear. She's a bladder cancer patient. She broke her wrist in November. She still needs to have physical therapy for that wrist, and she's months late for any kind of follow-up with the cancer. She won't go near a hospital right now, even though she says her wrist is in excruciating pain every single day. Here's what she said. If I go back to the hospital, I know for sure I will get COVID-19. Hospitals are so full of COVID-19 people. Can I tell you, this is why all of the news footage that shows packed hospitals, all the news footage that makes it appear like every single hospital in America is packed with people and every single person in the waiting room has COVID-19. That's what they want you to believe. That's what people have been led to believe. Now again, whether it's true or not, the likelihood of that is very nil, that every single person in a hospital has COVID-19. But guys, this is what people have as a belief in their head that's making them take risky choices of not getting adequate medical care when they need it. Like, this breaks my heart because this is going to be a lot more devastating to people's health than COVID-19. Like, are you seeing the connection here that we're so fearful over a virus with a less than 1% death rate that people are willing to let go of common sense that if you're in pain, you need to deal with that. If you're needing a medical procedure or have some kind of medical care because you've had a heart attack or a stroke and you'd rather stay home, 1 in 4 people stay home and ride it out, that could be lethal. Doctors say, please come back for your therapy, and my answer is no thank you. She's scared to death. She's scared to death, and she's not the only one. Many patients like Warren are shunning the hospitals and clinics right now. The coronavirus has so diminished any trust in the U.S. medical system that even people with obstructed bowels, chest pain, and stroke symptoms are all ignoring danger signs, and they're staying completely out of the emergency room with potentially mortal consequences. I'm going to correct something in this news story. I don't think the coronavirus has necessarily just diminished the trust in the U.S. medical system. I think it's driven by fear. I think people are scared half to death, thinking that if they step into a medical facility that they will automatically get COVID-19. That is the fear. I don't think it's a distrust of the medical system per se. But this is why all the coverage of COVID-19 in the news media has made it seem so bad that people aren't even willing to want to go in to take care of real health problems. Not to say COVID-19 is not real, but until you get it and you have ramifications from COVID-19, that's when it becomes real. Just the prospect that you might get it, the prospect that if you become infected, you possibly could get sick, that's not the same as I have chest pain, I need medical attention. And people are choosing, well, I'd rather have the chest pain than I would the coronavirus. And I'm going, what? Like, I don't even think they realize the ramifications of that choice. A study by the Centers for Disease Control and Prevention found that emergency room visits fell by 42% in April. And a Harris poll on behalf of the American Heart Association found that 1 in 4 adults experiencing a heart attack would rather stay at home or stroke than risk getting infected with the coronavirus. These concerns, listen to this, who are the people most concerned? The concerns are higher in black people. 33% of black people are refusing to seek medical care if they need it. Hispanic, 41% are avoiding medical care. Now, who are the most susceptible to the worst symptoms of COVID-19? It's African American people and it's Hispanic people. So you could see why they're fearful. They're fearful at a rate of 33 and 41% respectively, because that's what they've been told in all the news coverage again and again. Oh, you don't want to be an African American, you don't want to be a Hispanic, because you will definitely suffer the worst from COVID-19. And so these people are avoiding routine checkups on when you have a heart attack symptom or a stroke symptom. They're not going in for the medical care. Perhaps even more worrisome is the drastic fall off of routine screening. Models created by the medical research company IQVIA predict delayed diagnoses of about 36,000 people with breast cancer, 19,000 more people with colorectal cancer, all because people aren't going to get these screenings because they're fearful of COVID-19. In Newport Beach, California, Hoag Memorial Hospital Presbyterian, mammograms have dropped by as much as 90%. That's off a cliff. When you only see 10% of the patients you're used to seeing, you're not going to spot that woman with early stage breast cancer who needs a follow-up biopsy. According to Burton Eisenberg from the Hoag Family Cancer Institute, before the epidemic, he saw 5 melanoma patients a week. He has seen exactly 0 over the past month. There's going to be a lag time before we see the results of all this miscare. In 2 or 3 years, we're going to see a spike in breast cancer in Orange County, and we'll know why. And you'll see a spike in death. And that's what's most sad about all this. People are willing to die on the altar of the possibility that they might get infected with COVID-19. They're going to die on the altar of, I have cancer, I have heart disease, I have some other medical condition, of not getting that taken care of properly because they're fearful of, again, a virus that has less than a 1% mortality rate. I want this to sink in, you guys. The lasting health consequences of avoiding hospital care because people are scared of COVID-19 is going to end up being more disease, more death in the years to come. How could it not? There's a reason we have one of the best medical care systems in the entire world. We do. The American doctor and the American medical system, you know, as much as we dog on it for some of the things they think nutritionally, because they don't think nutritionally, what they do well is when you're sick, they save your life. And they can't save your life if these proper screenings are not taking place. They can't save your life if you're not able to go get checkups. And when you have chest pain, going to the emergency room and having them take care of you and figure out exactly what's wrong. And none of those things are happening. When 1 in 4 patient would rather be fearful of the coronavirus than to deal with chest pain that could be a heart attack, we have a problem. And that problem won't just disappear anytime soon until we acquiesce this fear over, again, I'm going to repeat, a virus with less than 1% death rate. And I read you earlier the leading causes of death. Number 1, heart disease. Number 2, cancer. Stroke is number 5, Alzheimer's 6, diabetes 7. All of these things are the things people should be getting checkups for. They're not getting them. We're going to have more totals in the future. Before the epidemic, we saw the 5 melanoma patients, now at 0. Dr. Farzad Mostashari, a former national coordinator for health information technology at the Health and Human Services, agreed there will be consequences for deferring chronic disease management. Yeah, there's a reason that you manage chronic disease. You're trying to ward off further consequences, and you're trying to help that patient live as long as possible. That's why these screenings are all important. Patients who have untreated high blood pressure, heart and lung, kidney diseases are all likely to experience slow deterioration. That's the thing too. It's not going to kill them overnight, but because the deterioration will be this long methodical deterioration because they didn't catch it, it's going to end up being deaths. We're going to look, 5-10 years from now. Oh my gosh, what happened to the rates of heart disease? Oh, they spiked. Oh my gosh, what happened to the rates of cancer? Oh my gosh, like people are going to be shocked, but it won't be shocking because they're avoiding the care now that would prevent it. Missed mammograms, people keeping up with blood pressure control. There is no question this will all cause problems. So what else is contributing to this besides the fear? Changes in the healthcare system have prevented some from getting the needed care. Many medical offices have been closed. I can tell you I live within driving distance of an emergency clinic that way, and I live within like a mile from an emergency clinic that way. About a mile and a half, I've got one there. They're all over the place around me. And as far as I know, that one is the only one that is still open all throughout the pandemic. The rest of them did close. And so if people don't have access to the care because these places have been closed, what do? So it delays timing patient testing and treatment. Other sick patients lost their company-sponsored health insurance because they lost their job in the midst of COVID-19, and now they're reluctant to seek care, according to a study by the Urban Institute. Another study by the American Cancer Society's Cancer Action Network found that nearly 80% of cancer patients in treatment had experienced a delay in their care, including 17% who saw delays in both chemotherapy and radiation therapy. They're not getting the care they need. And if we pretend like that's not going to have consequences down the road, you're a fool. It has to. That's why these things happen the way they do. Many screening facilities were shuttered while people were afraid to go to the ones that were open, again, out of the fear of getting COVID-19. And then there are patients who have fallen through the cracks because of the medical system's fixation on COVID-19. That's the other thing. There's so many resources going into treating COVID-19 patients, they act like nobody else can come into the hospital and have anything but COVID-19. And that's a problem too. All of this is this perception that if you have COVID-19, you go to the hospital, you get treated, da-da-da-da-da. Nobody's thinking about if you have chest pain, you still need to call 911, you still need to get to the hospital, you still, seconds count, all of those things to protect your body. And yet people are they're willing to take the chance with a heart attack symptom or a stroke symptom than to go to the hospital with the risk of getting COVID-19 that has less than a 1% death rate. That's where we are. Dimitri Tim is a 43-year-old loan officer from Watsonville, California. He began feeling stomach pain around mid-June. He called his doctor who suspected coronavirus. He directed Tim to an urgent care facility that handled suspected COVID patients, but the office was closed that day. When he finally was examined the following afternoon, He realized he had a burst appendix. If my burst appendix had become septic, I could have died. Like, see, that's why medical care timing counts. Like, I remember they used to run a commercial on TV about every second counts when you have a heart attack. Every second counts. You've got to get medical care as soon as possible because every second counts. Well, what's happening is people have thrown that out the window. Every second doesn't count anymore because they're so fearful of the coronavirus. We need to make it abundantly clear. They need to run some PSAs now that say, hey, look, we know you're fearful of COVID-19. We all have been kind of concerned about this and we're all doing our part to avoid that. But if you have chest pain, if you have pain and you need to seek medical attention, please go to the hospital. Like, they need to make that clear. And hospitals need to make it so that when patients walk in the door, they don't feel like they're walking into a death chamber. Because that's the perception in people's heads. Oh, if I walk in the hospital, I won't walk out. And to me, that's unfortunate. To me, people don't need to be that fearful over this when they have real health problems that they're facing between chest pain and stroke, and this poor guy that I just read about had the stomach pain and it ended up being a burst appendix. And so it could have become septic, and once that happens, he could have died. The degree to which non-COVID patients are falling through the cracks will vary by the region. Doctors in Northern California, whose hospitals haven't seen an overwhelming surge of COVID-19 cases, have continued to see other patients. See, that's the thing too. It's specific areas that have been ravaged by COVID-19 worse than others. And so I wonder how local hospitals could make sure that their patients in that area know, hey, we don't have COVID patients here. You're safe here. You know, come in with a mask, come in with gloves if you're concerned or whatever, but we don't have patients in our hospital, da, 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 da. You know, and I know a lot of the hospitals that do have those patients, they have a whole, section of the hospital just for them that's apart from the rest of it. I think the fear over getting COVID-19 simply by going to seek medical care, it's a little bit overblown. But again, that's because the news coverage of this has made it seem like COVID, COVID, COVID everywhere you look, and people just have become so fearful that they're not seeking the attention that they need. Non-COVID issues were more likely to have been missed in New York City, for example, when they had the big wave in April. The American College of Cardiology and the AHA, American Heart Association, have both launched campaigns to get patients to seek urgent care and continue routine appointments. Well, they can put out all the PSAs they want. They have to get the news media on board. I think if the news media catches on to this and says, oh my gosh, we had no idea all of our fear mongering was going to keep people out of hospitals, what did they think was going to happen? But yeah, that's something that's sorely needed. The impact of delayed care might be felt later this year and into next year if a renewed crush of COVID-19 cases collides with the flu season, which would then overwhelm the system, and what CDC Director Robert Redfield has predicted will be one of the most difficult times that we've experienced in American public health. So they're already predicting, you guys, that if you need care, go now. Because once the winter comes, you'll have the seasonal flu back, plus COVID-19, plus all of these things that we have in the day-to-day. The healthcare system's ability to handle it all is going to be tested, according to Anthony Wright, Executive Director of Health Access California. Some patients who stay at home may actually be avoiding doctors because they don't actually need care. And that's true. There are people that go to the doctor for every little thing. So if COVID-19 is keeping those people at home, that's great. But I think that's a very small percentage of the population. I think people that go to the hospital, especially chest pain and all the kind of classic signs of major diseases taking place, those people need care. Yale University cardiologist and researcher Dr. Harlan Krumholtz believes the pandemic could be reducing stress for some heart patients. thus reducing heart attacks and strokes. Okay, what? The pandemic is reducing stress? I don't know about you guys. I don't have a heart problem, but I have been under a lot more stress during the pandemic because until recently, now we have sports back. You've lost all your distractions. You've lost all the people that you usually interact with. You haven't been able to see human contact. I live alone. There's a lot of people that live with their kids. They're going crazy. You don't have those social things that are stress relievers. What are they talking about? Less stress for heart patients. I don't know what that one is. It's got to be more. So they're saying that's why there might be less heart attacks and strokes. After the nation shut down, the air was cleaner. The roads were less trafficked, and so paradoxically, people say they were experiencing less stress in the pandemic, not more. I don't buy that. I'm sorry. Anybody feeling less stress? Like, I'm really curious in the Jimmy Rants family. During the midst of the pandemic, has literally anybody felt less stress than before the pandemic? I haven't heard anybody say, "Oh yeah, wow, this is the best thing that ever happened to me." Now I know some people say, "Well, I've got more time and been able to like reflect on my life and da 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 da," and I suppose that could provide a little bit of stress relief. But come on, come on. While sheltering in place, they were eating healthier, changing lifestyles and bad behaviors. No, just the opposite is true. We have seen people turn to junk food. We have seen people engage in very bad behavior. The shutdown may have provided a sabbatical for our bad habits, according to Dr. Jeffrey Faust, a physician at Boston's Brigham and Women's Hospital. Again, I disagree with that. The bad habits have gotten much worse. We're making so many changes to our lives that includes heart patients. If you go to a restaurant 3 times a week or more, do you realize how much butter you're eating? Oh boy, we got one of those doctors. That is a good point. People aren't eating in restaurants, although you can still order through DoorDash or Uber Eats or some of those kinds of Grubhub, those kinds of places. You still can have food delivered to you, and there's probably people that have been using that on overdrive. But that's true. You're not going to a restaurant. It has nothing to do with the butter you eat, but I suppose eating at home. But what people have done is they bought junk food. Do we think heart patients eating junk food is suddenly going to make them healthier because they ate it at home as compared to a restaurant? While some patients may be benefiting from a COVID-19 change of regimen, many people have urgent and undeniable medical needs. Some are pressing through this fear of the virus to seek care after balancing the risks and the benefits. Yeah, about 2.5 months ago, I had to go to that urgent care center over there because my right ankle was swollen and I couldn't figure out why. It had stayed swollen for a little while and it's starting to get a little bit painful. And so when I went there, there was exactly one other person in the waiting room, and that was it. It was wide open. I got seen pretty quick. I had a physician assistant see me first. Then when he couldn't figure out what was wrong with my ankle, he brought in a doctor. They said it was gout, by the way, and they prescribed me a couple medications. I refused to do it. I talked to a few medical friends of mine, and they said, well, just do this and this and this, maybe eliminate this and add this and da da da. The tart cherry supplement was the big thing. And the swelling has gone way down, and it's minimal pain now. So it never went on the drug, by the way, but it's doing much better for those of you that ask about that. But the point is, I went for the medical care, and not once was I fearful. Now they did make you wear a mask when you walked in, but that was it. Was wearing a mask, and there was no fear in my heart that I was going to get COVID-19. In March, when the virus took hold, Kate Stewart Mack was undergoing a clinical trial at Hoag for her stage 4 ovarian cancer, which had recurred after a 9-month relapse. Members of her online support group considered staying away from the facility, again, afraid of the virus. But this 69-year-old child psychologist had no choice. To stay in the trial, she had to keep coming to the outpatient chemotherapy appointments. She said, we all make choices, so you have to be philosophical about it. And I thought it was far more risky not to get my cancer treatment than to face the off chance that I would contract COVID on an elevator. And she's right. Like, this is the reality check. People think getting COVID-19 is the end of the world. They think it's the black freaking plague. I hate that people think, oh my God, the last thing I want to do is get COVID-19. Guess what, guys? Every single one of us is eventually going to get COVID-19. The degree to which we fight it off is not going to be predicated on a vaccine. It's going to be predicated on your state of metabolic health and your ability to fight it off through your T cells as part of your immune system, through your actual immune system itself and creating antibodies to attack this. That's how you get rid of a virus. So let's stop pretending like we're going to avoid COVID-19 forever. We're all getting it eventually. And so this irrational fear of trying to avoid COVID-19 like it's the Black Plague, and having that fear is preventing you from going to get routine care for chest pain, for stroke symptoms, for stomach pain, for some other thing that you would need medical care for. We've got to stop that. Like, if you know people in your life that are avoiding medical care out of this abject fear over a virus that has less than a 1% death rate, like, educate them, help them out. Tell them, hey, it's more important for you to deal with that heart issue. It's more important to keep up your cancer treatments, because you will be a statistic in the death category much sooner than you would have been had you gotten the care. All right, I want to see what you guys have to say. We're going to come here first over to Instagram, then over to Facebook, finally over to YouTube. Thank you all for being here today on Jimmy Rants. JimmyRants.com is the website. Kat says, in general, I fear 99% of doctors. Knowing backstage of that business, everybody should too, unfortunately. Yeah, Kat's a trained medical doctor as well, so she knows. Marnie, if you die of a car crash, for example, but have COVID, you will be counted as a COVID death in the daily numbers, regardless of the death certificate. Yeah, I've heard a lot of those kinds of things. This guy in Florida died of a motorcycle accident. They took him to the hospital, gave him a COVID test posthumously, and he had COVID-19 death. That's a whole nother subject for a whole nother day. But yes, that kind of thing is happening. So Donnell, you have a general question. We don't do general questions when I'm talking about a specific topic, but you're in luck. Tomorrow is Ask Me Anything. And on Fridays at 11 a.m. Eastern Time, we literally take those kinds of questions. Please bring that back tomorrow. I won't remember to answer that, but that's a great question. I would love to answer on Ask Me Anything tomorrow. Marnie says, I manage my stress, but it sure ain't less. Yeah, I don't know anybody that would say that they have less stress right now. So those doctors in the story who were saying, oh yeah, this lockdown and quarantine and all the race relation stuff being stirred up and all the country being pulled apart. Yeah, that's all stress relieving right now. They've got to be kidding. Thank you, Instagram. Let me pop over here to Facebook. What's up, Facebook? See what you guys have to say. Kira says, but can we really trust that cause of death was recorded? Confusing info about died with COVID-19 versus died of. Yeah, again, I think anybody that looks at that statistic of 160,000 people dead, I think we have to just know inherently in that number is going to be quite a few people that probably would have died of whatever the actual comorbidity that they had. They would have died of it sometime this year. There's actually been people that have done that analysis, and they say it could be upwards of 25% of the people who died, who are in that COVID-19 death rate and number of deaths. 25% of them probably were going to die in 2020 anyway. And so, I mean, that's a significant portion of that total, which is what makes the constant repeating the total every day in the media so nauseating, because it's not accurate information. We don't know who died with versus who died of COVID-19. Norma says, many hospitals that have flattened the curve have laid off or giving employees days off. So many hospitals are understaffed, which means longer wait times in the ER. And for testing, nurses are growing frustrated because they see the problem, but the higher ups can't see it. As they sit behind the desk, they don't have a clue. Many nurse friends of mine throughout the US have expressed this to me. Yeah, Norma, you're not alone. I've heard that as well, that a lot of these hospitals, the reason why they're full is not because the whole hospital's full, but they don't have enough staff to deal with all the patients because people stopped coming in for these routine checkups. And so that's loss of revenue. And a hospital is already kind of on thin ice with revenue. So when you have a sudden drop, what was the mammograms down by 90%? You have that big of a drop, you're going to have to lay people off. There's no way you can financially survive. Tracy says, I don't believe the numbers that are put out. Also, I'm at the point that it really makes me mad when people or the media try and make me feel I need to feel that fear. I'm being sensible but refuse to be afraid. I had to hold off on my yearly checkup because the places were shut down. Yeah, you're not alone. There's a lot of people in your situation that believe the exact same way. And I try to be that way as well. I'm not fearful of COVID-19. I'm ready to kick its butt if it comes to my body because I know I have metabolic markers that show I'm in pretty good health. And so I actually wish I could get it and get it over with because like I said, we will all eventually get COVID-19. Thank you, Facebook. Let me pop over here now to YouTube, see what you guys have to say. Bill says, yes, this seems very hyped. I predict suicides will be up this year. Oh, suicides are already way up this year. In fact, I've got a story I'm going to read on Ask Me Anything tomorrow that the CDC chairman has actually said teen suicides has become a massive problem and we need to get it under control. PJB, if I had a major health condition, I would do whatever I needed to do to get healthy. My distrust of the medical system comes from big pharma and doctors who cannot stay up to date. Well, that's true. They do. That's true. Ryan says, thank you for bringing this important truth. Highlights the need to eat better, keto or low carb, cutting out sugars. Yes, all sugars and junk seed oils. Real food is where it's at. Hear, hear. Harpsy says, my medical care started before COVID-19, where I go for treatment. It seems the same as before. It's a clinic, not a hospital. They do checkups, temperatures, an appointment must be arranged, and masks are worn by everyone. Well, that's good. Abel James, what's up, my brother? Like you usually over here on Facebook, man. I get you on YouTube here today. Hey, Jimmy, loving this rant. Looking forward to our chat. Yeah, we're going to chat with Abel for my podcast a little bit later on, my Real Talk podcast, in about an hour and a half, Abel. So I will see you there. Kat says, I think there is a huge mistrust in doctors. If a patient doesn't think he can be safe in a medical facility, that is a different topic. Well, again, I think it's the perception when they put on the TV screen all of these images of people in the worst of the worst condition. And I've seen this again and again. In fact, I was just looking at a post this morning where somebody did a close-up of some of the patients that were on the table. They were dummies. They had put dummies, wrapped them up in like the garb for the hospital and made them look like they were COVID-19 patients for the TV cameras. Now I'm thinking, okay, why don't you show what's actually happening rather than having dummies lined up and making it look like you're treating patients? Like when I saw that, I was like, what? And so that just stokes the fear even more. Oh my gosh, look at all those people on the respirator. Oh my gosh, that's gonna be me if I go to the hospital. And so they're not getting the care they need for chest pain or for stroke symptoms or any of the other things, stomach pain, all of these things, you need to go seek some medical attention. Yeah, Kat, I'm not kidding you. I saw that today, and they're using dummies in a hospital setting for the media, so the media would have a shot of a full hospital room full of COVID patients. Now, I'm sure there are some hospitals where they do have a full room of COVID patients. I'm sure in New York City, at the height of this in April, they probably did have that. But why do you have to contrive it? Why do you have to put dummies down? Like, if it wasn't for somebody like really zooming in and showing you the picture, it's obvious that's a dummy. Now who's the dummy? Those of us watching that and being fearful, right? So I hope this Jimmy Rants today is a salient reminder that if you need medical care, go get medical care. This fear over a virus that has less than 1% death rate. I want that to sink in. Less than 1% of the people, way less than 1% of the people who get COVID-19 die. Okay? So let's stop pretending like if you get COVID-19, it's a death sentence. It ain't. Most, by a vast majority, are going to survive. And so you don't need to be fearful. And you do need to go seek medical care if you need it. That's it for this episode of Jimmy Rants. JimmyRants.com is the website. And as always, you can engage live in the content. You got to go follow me over here on Instagram. I am at Living Low Carb Man, LIVINLOWCARBMAN. Once you're there, go check it out, you guys. We're here Monday through Friday at 11 a.m. Eastern Time. Be there, be square. It has been for 160,000. It has been for 160,000. Yes, 160,000 people have died, and I'm certainly not diminishing that. But what I am saying is people don't need to be fearful because of that very small percentage. Like, we have a greater percentage of going out here in our cars today and driving on the interstate and getting into an accident that could be potentially fatal. You have a greater percentage there than you do of dying of COVID-19. Like, that's... Statistically speaking, we just need to keep things in context. Yes, it's sad for those 160,000 people, which again, there's debate over how many of that 160,000 is actually COVID deaths versus maybe some other things in there. But let's just say it's a good number of people. Yes, it's sad that that happened. So this is very real. So I've made that very clear in all the times that I've talked about this. But I don't think that should be reason enough for people to avoid medical care, which was the whole point of this Jimmy Rants here today. We also simulcast live over here on my Facebook page as well as on my YouTube channel. So thank you all for being here today on Jimmy Rants. If you missed the live, be sure to watch it on replay on Instagram. It's on IGTV. We also throw the past episodes up over on YouTube. Type in a keyword Jimmy Rants, you will find the show. Finally, pop on over to JimmyRants.com. It's the official website for this show, and while you're there, click on the Patreon link, and a donation of any amount would be greatly appreciated. All right, guys, that's it for now. We'll be back again real soon with more Jimmy Rants. Ask Me Anything is tomorrow. We'll see you then. All right. Done and done. I always find it interesting when I start talking about COVID and you talk about death rate. You almost invariably have somebody like that lady at the end there. Well, it's real for those 160,000 people that died. Okay, yes, obviously. Like, nobody is arguing that point. The point is we're going to basically cause all of these other health issues, all because of a fear over something that has a 99-point-something% recovery rate. Like, if you're kind of doing a risk assessment of something and a doc says, you know, I could try this, but it only has a 99.7% success rate. I don't know. I think you need to be fearful of that 0.3%. You want to try it though? You want to give it a go? Everybody's going to say yes. Everybody with a 99.7 success rate, and in this case 99.7% recovery rate. That's what makes this story that I read here today so sad, is people think it's the other way around. It's a 99.7% chance you're going to get it and you're going to die, and that's just not true. All right, guys, let me pop off of here for now. I do have another interview this afternoon So I got to go get prepared for that. But thank you for watching here today. We will be back for Ask Me Anything tomorrow. So please come back 11 a.m. Eastern Time on Friday, and we'll see you then. Bye, YouTube.